I'm Nathan Gardner. Right now, currently, I'm the executive director of the Backdoor Mission in Oshawa, which operates the Mission United Hub, an integrated healthcare service hub for the homeless. So Backdoor Mission, I've done a million tours there now, so I should have this down. They started in the late 90s through the Reverend David Moore, and it was really just an idea of a way to support the community within downtown Oshawa. And at the time, that meant poverty, homeless, but not really to the degree it is today. So it started as really a combination of, I think, 5 churches committing volunteers to Simcoe Street United Church, and they would just simply hand out meals, coffee, muffins, out the back door in what's now the gymnasium, and then volunteers would spend time with people, respite services, a little bit of, I know where you can get clothing or something like that. United Church took it over full-time. 2014, it was incorporated as its own nonprofit organization with an employee and a small, modest budget. They did a little bit more navigation services, assisting with more ingrained services that are in the community. And then, of course, COVID hit, and it really gave the opportunity to become what it is today, which is an integrated care service hub. So basically, if you think when March 2020 came around and the whole world shut down, if you think about individuals who are homeless, when all services doors stopped, there's nowhere to go, you physically couldn't go anywhere. Most people had the ability in some way to adapt to a virtual world. Well, if you're homeless, it just didn't exist. So there were a couple places. The first one in Durham Region, and specifically Oshawa, the Backdoor Mission opened its doors. We brought in primary care practitioners, brought in some housing support for people that needed it, Ontario Works and financial support, some basic services, and it really morphed into an organic service hub, which met the needs of individuals who are sort of in the worst place in life, and that is, as we say, experiencing comorbidities or complexities. And for layman's terms, that's individuals who are chronically homeless. They are suffering from mental health and or addictions issues all at the same time. And so they can come to the Backdoor Mission, which operates what we call the Mission United Hub, and they can receive those services all in one place. So in the old world, you go try to get, you either go to the hospital or you go to a healthcare facility. You need to get insurance, you need to get identification, you need help getting your housing. You had to make appointments and go to different places all over the place. Try to catch a bus, try to get tickets. In many cases, it just didn't work for people, and especially if you are suffering from either cognitive disabilities or are in active addiction, that's just another compounding challenge to try to achieve all of these things. Well, we make sure we take care of all of those core elements while providing core services such as meals, washrooms, pantry items, clothing, and wrapping around with supportive individuals, so people providing case management, engagement, and really just support workers to make sure that people feel like they're somewhere that's part of a community.
Do you remember your first exposure or encounter with addiction?
Yeah, it was kind of by chance, and so part of my upbringing, we had a close family, extended family that would always meet on the holidays and big events, that sort of thing. I had an uncle who has recently since passed away, but always was just kind of the uncle at events. Always saw him as a family member. As I got older, I was told through my father and through my family that he had actually suffered with addictions his entire life. Was positive with hepatitis C, had been in and out of missions, shelters, that kind of places in Toronto and Hamilton and all around sort of the gambit of the GTA. And actually had done the travels out west and come back, and really a story that's similar for a lot of people that suffer from addictions and enter into homelessness and into that world. I remember it was kind of a surreal feeling because it wasn't here I'm experiencing addictions in front of me. I'm being explained and trying to compound the memory of all of the times I'd interacted with my uncle. And okay, was this the reason for this? Was there any type of different type of actions or behavior or anything about this person that was different that I'm kind of now noticing, knowing the information that I have. At the time it was something to kind of work my mind through, knowing that I'd been that close to addictions my whole life without really knowing it. But the big thing I think that really carries through into my belief and philosophy working now is that it didn't change my opinion in any way of my family member or my extended family. There was a lot of, had a very affluent, he grew up in an affluent household. His father, my grandpa, was an engineer in Oakville of all places. So, probably what you'd kind of say would have a good support structure system as really as you could, but was somebody that fell into this life either way. And so what I understood is kind of a backgrounder of this is something that can affect anybody. It doesn't matter how strong your support system is. That can definitely increase your chances, as I learned, of working through recovery. But it also doesn't change the way someone can feel. I mean, you can be frustrated, but the actual emotional feeling of how you either love somebody or interpret them, I don't think whether they're working through addictions or not, in my experience there, changed that in any way. So that's something that I can really point to and carry into my work. I'm not sure at the moment if I realized that it impacted me in that way, but since then it has.
I've been asked 1,000 times, where do you think addiction comes from?
Yeah, it's funny because even though I have been asked that before, clearly it's still it's always concerning to give an answer because there's a clinical answer, there's a community-based answer, behavioral for sure. I mean, trauma. There's often, I almost hesitate to say always, but often an element of trauma. There is an element of a lack of support or an environment. But to me, having so many different people from so many different backgrounds enter into our world. And remember, we're working with people who are chronically homeless, and so they're really, really in the roughest places of addictions. To me, I really think it comes from a place of belonging, of lack of belonging for sure. And that can be within a family unit, that can be within a community setting, that can be within your own head, within your own either ability or inabilities, within your own mental capacity. But to me, I think what I've experienced as addictions usually replaces something, and that's kind of something that can really permeate through many different demographics, right? So obviously, if you're from a certain demographic, whether it's financially based, economically based, racially based, population based, there's more prevalency to enter into addictions based on our statistics, but that doesn't mean that anybody isn't susceptible, because really what you have to have is a strong sense of community and a strong sense of belonging and familial unit to be able to work through life. It's extremely important. It's an extremely important pillar of life, and often addictions is something that really replaces that when it's not there. But to me, the biggest thing is what creates it. It's especially this day and age, man, with the types of drugs that we're dealing with. It's a lot quicker. It's a lot quicker where it can impact and affect you. I think in an old world you could get away from it a lot, easier. But the way that our the supplies are affecting people is that it's kind of, once an individual is a little bit susceptible, they're at such a higher risk nowadays because of that. Well, I mentioned a lack of belonging. I think the physical manifestation of that is pain, right? I mean, lack of belonging leads to a sense of internal or external pain. And if people are impoverished or if they're homeless, whether it's economic or physical, there's kind of a natural pain setting that goes in there as well. So if you're traumatized through your experience, whether it's a physical experience or hunger, lack of food, lack of housing, lack of lodging, a lot of time, the use of drugs and entering addictions is a replacement of pain. It alleviates that. And so if you are living in poverty, then just by proxy, your world is usually a lot harder. Each hour to hour, minute to minute is more of a struggle, and there's more pain ingrained in that. So to me, it's pretty natural that first of all, drugs are just more easier, that's not a word. They're more accessible in places that experiences high prevalence of poverty. And so it's just a very quick fix. It's a very, serotonin, dopamine fix so you can go and alleviate this immediate pain that is usually caused by the parameters of poverty. So it's a pretty natural kind of supply and demand that geographically places that experience a lot of poverty are just they're breeding grounds for addictions to thrive, really.
Well, I mean, that's the thing, is like sometimes the substance is the only thing getting you through your day.
Yep.
And I've been there, so I can appreciate how you do get there, and
Yeah.
Like, and it's just, you can't expect anybody really to be getting into recovery or whatever, like, while you're struggling to figure out what you're going to do about your next meal, where you're going to sleep, what you're going to have that night. And
Yeah.
am I going to be safe doing so?
Well, that's the whole theory behind our work, right? Like, I mean, we have a sleep area, a daytime and overnight. We have meals available, showers, like just the basic necessities of if you're going to work on something that at this point is the most important and the hardest thing probably you're going to do in your life, which is face your addictions head on and enter into how we do withdrawal management, a withdrawal management plan and a recovery plan. It's going to be hard to do so if you haven't slept and haven't eaten. So, those things have to be addressed first. And we hear a lot, especially when you splice the housing world and social services world together with healthcare and addictions, which comes first? What do you tackle first? How do you do them together? I mean, I think it's pretty hard to argue that if you haven't eaten or haven't slept, those are things that have to be done first, because you can't physically survive unless you do those things. To get into the stigmatization of individuals who are homeless and suffering from mental health and addictions, you probably need to reset your tape of all the things that exist within that. I actually think, to be quite honest, I think that our world in Canada specifically, we do a pretty good job. That's one thing I would say, that it does a pretty good job of really attacking destigmatization. It doesn't mean it eradicates it, but I think, and I have to say, I have a little bit of a different experience. I think a lot of people that we experience that you would believe have a stigmatized understanding of those that are suffering through addictions. It's really not always the case. It's always a stigmatization of the system that people like us are really not focused on approaches and programs that are appropriate, that we don't really have the expertise, that we have a focus towards funding and money rather than the individual. A lot of the time, I would say our experiences, people do have a lot of sympathy and understanding and empathy for individuals who are going through. They just don't equate that a lot of the time to how I guess they focus more on the immediate impact and societal community-based impacts of substance abuse, addictions, and homelessness, rather than the individual health outcomes. A lot of the time people are going through very, very tough lives and extremely rough days. That type of behavior is a lot of the time warranted, and it could be ingrained within a lot of what they're going to, or a lot of who they are. It doesn't mean that there's necessarily violence or immense suffering at the time. That's inherent. And I think it also, the biggest stigmatization I would say that's restrictive to us is that person doesn't either require or have earned care, because if individuals are in a place where their behaviors or the way that they're acting is really not in a respectful manner, usually that's when they need care, and that's when they need approaches that are empathetic the most. And I think the stigmatization that we really see is when people are at their worst, and when people are in the results of addictions are manifesting in poor behavior. That's when we need to intervene the most. That's when we need to do things like de-escalate crisis management, provide health care in the moment, provide really companionship and empathy as much as possible. I think that's the biggest stigmatization on the ground day to day that we see that impacts us, is the correlation between behavior and results of addictions and mental health, and the response that's warranted there. Because a lot of the time in our society, a response that's expected is usually punitive, that's based in enforcement. And our biggest education piece that we try to, or understanding that we try to kind of put across to communities is that that's the behavior that really warrants a lot of empathy most of the time, and that's what's going to get the results that we need. Yeah, I think if you look at it at its core, it really shouldn't be controversial at all, because to me harm reduction is just minimizing the negative impacts of, for this we focus on drug use, but really on any type of either a behavior, minimizing the negative impacts through any means possible. So I equate it to trafficking. So if somebody is being trafficked, if they're within human trafficking, minimizing their impacts could mean as much as using protection or not carrying money on them. Like, that's a form of harm reduction. If you're going into a space where you're at risk with an individual, making sure that you have somebody hold on to your money, your belongings that are important, that's a form of harm reduction, because basically you're reducing the risk of harm because of an action, a proactive action you're taking. So what people like to think of it, which it does include, is safe supply, so safe needles, safe anything really, and programs, which we do run at the mission, around either needle exchanges or the provision of safe use products, which is really important. It also can pertain to withdrawal management programs, which includes Suboxone, methadone, whatever that might be. To me, harm reduction, again, from a clinical level, and I shouldn't say clinical level, but from as it pertains to substance use, is really, again, just trying to minimize the impact of the behavior. So if somebody's in active addictions and they're going to use, recognizing that is a harm reduction approach, and doing whatever we can do to make sure that that use is safe is important. Now, from our standpoint, harm reduction, and I hope I'm very clear on this, when it comes to treatment, harm reduction has to be part of a broader strategy. So harm reduction only, it can only go so far. It doesn't mean that it's not important, as is, but having it as part of a strategy and a plan that includes, either whether it's behavioral change, whether it's cognitive therapy, or a combination of a whole number of different things. We always say an individual doesn't have to get to the level. It's not our expectation that an individual gets to the level of sustained sobriety. It's that they get to a level of sustainability, so that they are stabilized and they're able to function. The thing is that harm reduction, the approach, it has to be viewed differently over time, because it includes new programs, new drugs, anything within medicine. It is a medical approach. It evolves, and so if we're taking, so do the narcotics that we take and the substances that are being used. So, if we have to evolve our frame of thinking of harm reduction, where there is a new form of withdrawal management that's permanent, so somebody might be on, an opioid management program that they're going to be on for the rest of their life, but that allows them to lead a safe and healthy life. That's something that us as a society and us as an individual kind of have to wrap our heads around. It doesn't mean it's the approach. So harm reduction really is an individualized approach for each person, but at the very basic element, basic end, it is minimizing harm and the risk of harm by small to large behavioral changes. I think it's more than education. Like, I think in our sector, what we're really bad at, and the sector is being the community sector, healthcare, social services, we're really bad at believing that there is a PowerPoint slide out there that's going to change everybody's mind on things. Because yes, education is important. Of course it is. It's got to be a part of an approach. But I think there's a recognition about community that has to be reciprocal. So just by nature, to be a part of community doesn't mean how am I going to give, but how are we going to approach this thing together. So I think engaging communities about, not just how they can be a part of the solution, because I think there's a number of people out there that if you go to, they recognize this is an epidemic, homelessness, drug use, opioids, it is out of control, it's going to be the downfall of our society, how do I help? Yes, there's a number of people out there that you tell them, sign a petition, come and volunteer, get behind it, donate money, all those types of things, and they'll say, okay, okay, okay. But there is a large majority that say, I have my life, and it might include a business or a family or both or otherwise, and how is this going to impact me? How is this going to impact the rest of my community? And I think we need to do a better job of listening to that as a group and approaching problems together. And you know, from an interview standpoint, that just sounds like a yes, that makes a lot of sense. But getting around a table and approaching it, one, from a space of equity, so that if we're approaching, you know, societal issues, we understand that the people sitting at a table, there might be more of one type of person than another. That's a form of inequity that can really impact a conversation and an approach. So really having an eye towards that there's a form of equity around our conversations, and that we really establish parameters of trust first. You know, a lot of times what you see are issues, decisions, and they result in town halls. So we have governments most of the time host town halls. We're going to make this change. We're going to open a shelter, put up a safe injection site, or we're going to, you know, bring our anger to one place. If it's on the other end, proactively say, we don't like what's in our community. And those are just not good places to start. They come with a sense of ingrained frustration or with a preordained message, and they're not coming with, let's focus on building relationships. And I think, and that's really coming from a place is we want to solve problems quickly. And problems that are community-based can't be solved. They have to be, can't be solved quickly. They really got to be thought out thoroughly. And it's why at the mission, we've really established trust and relationship building as a pillar of a value. Like, it's one of our main core values, because you know, we know this. A change in behavior as pertaining to substance use takes years. Most of the time, often takes years. We got to look at community the same way, that we build trust and relationships first, and then, and really only then, you know, somebody can provide value that is, you know, not part of a certain community, but can be ingrained into that community. I think that's really the approach that we have to have. Of course, education's there, but listening, understanding, building trust, and then identifying the problems. That's really the approach I think we have to take, a really more long-form approach. Yeah, you know, the reality is we don't do a good enough job of that, because it impacts us more than we know at the time. For me now, my biggest concern is the impact on staff more than anything. I think and we have lost a lot in the last year. I can remember one very distinctly that I actually knew and interacted with that was impactful to me personally. But most of the time, it's our staff who are interacting on a regular, daily, all the time basis with individuals. And so, you know, when we make the announcement, we had one this morning actually, you can see and you can hear the drops within our staff, because they're just so devastated on that. And that's taxing on a leadership level for sure. You know, the one thing that has really been important is every meeting we've ingrained our success stories. That helps reset us. So, you know, when someone goes through and they have been in a place that is really just horrific and has really caused a lot of doubt, consternation, stress, and a lot of negativity, pessimism, you know, when we get to find out that they've come back to us and said, hey, I'm good now, I can see my children again, or I'm housed, or I'm clean, or whatever their story might be, and they're happy, it's really important that we share that, because that's kind of what will help carry us through the while we go through the tough times. You know, not me, but a colleague has said it's important to know when we lose somebody that it's not a failure. It's really, really important to know. I remember one individual that had passed away from overdosed in an apartment. Everybody was very devastated, but they really made a point of saying, hey, because of us, that person had an apartment. We were the ones that did the work that got them in there. And yes, they passed away, but one, they didn't pass away in the street, which is, you have to take that as a win. And the most important thing is to know that they were loved, because they knew from us that we provided a community to them. So they knew that they passed away with love. that type of positive messaging is really, really important. For me, myself, it's trying to make sure you take time to connect with your own family and your own interests in your life. Sometimes you don't do that enough. Sometimes I don't do that enough. But really trying to make sure that your time away really is mentally and physically time away as much as possible. But also, I think a lot of people say that around self-care strategies. I think trying to ingrain positivity into your everyday so that your work with this population and these individuals cannot just be what it is, which is a lot of despair from 8 o'clock to 5 o'clock each day. There's got to be positivity built into that, and as leadership we really have to try to produce that, and you have to kind of keep that in your mindset as much as possible in a day. We got a ping pong table. Small things. That's whatever you got to do in your workplace to make it a good day.
So within that, how do you guard against burnout?
It's really interesting because I'm an executive director, so technically I have the flexibility to, craft hours in a way that you would think I can take days. But also, in leadership roles, usually that's a burden of responsibility, so you end up burning out a lot quicker. This is the toughest field, quite frankly, for burnout. Like, it's such a high prevalence of it. And I think I try to do my best protecting about it by maintaining interest, by going to places that are escapes. So for me, that's sports as much as possible, and family life. When family's not also a burden, I shouldn't say burden. I'm not a stressor. Don't edit that, but you know what I hope you know what I mean. Family can be it's your biggest getaway. It's your greatest place. It's I love my family more than anything, but also having young children can be a stress added on as well. But it's also just remembering relationships, right? So we have a lot of preconceived, anxieties, and we have a lot of stress that's relational within our work, and sometimes we can lean into that and start to believe people have either expectations or beliefs about you or preconceived notions. And I think it's really important to stop and think, hey, relationships and just relationships for the point of relationships with your coworkers, staff, colleagues are important, and remember that. So I try to focus a portion of days on just talking to people or engaging with people that is not work-related. Because knowing an individual doesn't just see me as a work colleague, as a work only, is an important way to me to kind of mitigate the burnout factor, because it can't just be stressful interactions with clients, partners, stakeholders, and then stressful interactions with the people who are supposed to be your biggest supporters. We have to kind of recognize that we're all people as well. So what I would say to somebody that's entering this field is always try to remember why you're here. And that goes two ways. So, I don't think we get into this field and this work thinking about the fights or anxieties we might have with coworkers, interrelational problems, trying to get promotions, move up the ladder, that kind of thing that typically goes with work. I don't think anybody really gets into this field particularly with those things in mind. However, it's natural. And so one of my biggest problems is that I have a lot of the time with staff, coworkers, colleagues, is that we delve down a road about what we think problems are within an organization or approaches, and we seem to not have the clients or the people that we're working with in mind all the time. When you do that, then I think you'll take a step back and you'll realize that everybody that you're working with is there to support you, and that they all have the same kind of view. Because the reality is you can't go into this field and think, I'm going to do it. It is not possible, because nobody has all that expertise. Nobody has the ability to connect with all types of people. So we're going to have to rely on a lot of different partners and a lot of different relationships, skill sets, people, in order to have success. The sooner you recognize why you're here and that it's not all you, the more successful you'll be with your approach. And the approach is really, really important. So, remembering that is really important. And more than anything, it is a long game. You can't looking for results, whether they be personal, professional, or for the clients. in a matter of days, weeks, and months. It is a long game in this field for sure.
Is there anything we haven't covered that you would want to say?
Oh man, I mean, we talked a lot about community. To me, I would say I'm humbled to be asked to give my feedback and I guess quote unquote expertise on addictions. To me, the only thing it really lies in is that ability to connect as communities. You know, we have a term, we refer to community as an ecosystem, because an ecosystem kind of pertains to energies creating a space, and we are all energies within that space. So whether it's, you know, creating a multi-million-dollar, I don't know, complex, or trying to solve the crisis of addictions and homelessness, it's a community approach, and the more we recognize that we are part of that ecosystem together, and other people are part of that, the more successful we can be. Yeah, I think that's about all I can add.